The new norm needs to be that we all wear masks. That's just plain and simple.
Bev Lorman is an ICU nurse at Peace Health Southwest Medical Center. I first met Bev back in April when COVID-19 was new.
To be honest with you, I never thought it would be going this long at the beginning of this.
I wanted to see how things have changed for frontline workers since then. Every hospital is different, but Bev shared her perspective.
At Peace Health Southwest, we've got a routine down.
That routine includes new ways of conserving PPE, which last spring was in short supply.
We were conserving PPE by putting the IV poles outside the rooms so that we didn't have to go in and out of the room so much.
Now the hospital has cordoned off a 7-room block of one unit just for ICU-level COVID patients. There's still no vaccine for the virus, but Bev says doctors and nurses are improving treatment methods and how they protect hospital staff. That's also the case at OHSU.
Nothing in our hospital looks like it looked before.
Dr. Matthias Merkel is a senior associate chief medical officer at OHSU. He says improved early diagnosis, isolation, and treatment methods have helped.
We developed workflows to make it much more streamlined than when at the beginning of March, we didn't really know what we are facing.
Dr. Merkel says OHSU is focused on treating the most critical patients requiring ICU treatment. He says those who survive almost always face a long road to recovery.
It is critically important that we remain vigilant, that we are social distancing, that we wear masks, that we wash hands. Our biggest defense is still not getting infected.
But as case numbers continue to rise, there's concern that the public is lowering their guard. State health officials say small group gatherings between as few as 2 families are a big part of the uptick. For nurses like Bev, it's frustrating and the undoing of so much hard work and sacrifice.
There for a while, we were having maybe 1 or 2 patients in that needed ICU level. It was kind of a gift. But within the last couple of weeks, we were completely jam-packed full in our ICU. We're praying for a quick end to this, so I don't know if that's going to happen.
Catherine Cook, KGW News.